Bismillahirrahmanirrahim. Dear students, Assalamu alaikum. I am Waqar Ahmed, visiting lecturer, Jahanzib College and Research Associate, University of Sawat. I am making this video lecture for zoology students as well as microbiology. Today, we will study about the epidemiology of infectious diseases. Now, epidemiology is a Greek word, epi, upon, and demos mean people or population, and logi study. So epidemiology, it is the study of the distribution frequency or pattern. We will discuss it. And determinants, the causes and determinants, it involves the causes and the risk factors of health related states or events in specified populations, and the application of this study to the control of health problems. So in epidemiology, we study about the spread of any disease in the population and also the control of this disease. The distribution in epidemiology, it is concerned with the frequency and the pattern. These are the two different terms, the frequency and pattern of health events in a population. In frequency, it refers to the number of health events such as the number of cases of meningitis or diabetes in a population, and also the relationship of that number to the size of population. For example, if the total size of population is 1 lakh and the number of cases of meningitis or diabetes are 1000, so this 1000 out of 1 lakh is the frequency of disease. The other is patron. The patron, it refers to the occurrence of health-related events by time, place, and person. Now, by time mean that the time patrons, it may be annual, seasonal. For example, some diseases occur annually, seasonally, weekly, that in which season the disease occur most, weekly, daily, hourly, that influence the disease or injury occurrence. The place patrons, it includes the geographic variation. For example, the disease occur more in urban area, in rural area, the location of work site, for example, in schools, in workplace. So this is the place pattern. The other is the personal characteristics. The personal characteristics, it includes such as age, sex. For example, some diseases are more common in male, some are in female, some are common in the married persons, in unmarried persons. So we also investigate the personal characteristics. The other, that what we study, what we investigate in the epidemiology, what are the public health problems that can be investigated. So we can investigate the environmental exposures, the infectious diseases, now injuries, non-infectious diseases, natural disasters, and terrorism. Now we will discuss about the disease. Disease is a French word, des, from, and as mean is. So this is an impairment of the normal state of an organism or any of its components that hinders the performance of vital functions. So we can also say that this is the deviation from the normal state of well-being, and disease is a response to environmental factors. For example, malnutrition, industrial hazards, or it may be a response to infectious agents, viruses, bacteria, and so on, and it may be the inherent defects of body or combination of these. The other is health. Health is the opposite to disease. One is disease and the other is infection. Infection is opposite or different from disease. In infection, there will be the inclusion of microorganisms. For example, viruses, bacteria, fungi. So if a disease is due to the infection, so then that disease is called infectious disease. But every disease is not infectious disease. If the disease involves microorganisms, so then we can count that this is the infectious disease. The other is the health. Health, it is the condition in which the organism performs its vital functions normally or properly. Now the epidemiological terminology. The first one is sporadic disease. When a disease occurs occasionally and at irregular intervals in a human population without geographic concentration. So this is sporadic. For example, tetanus, rabies, and plague. So this is sporadic disease. The other is endemic disease. Endemic, it is a Greek word endemos, dwelling in the same people. Or dwelling in the same people mean that when the disease occurs regularly, residence, dwelling means residency. That when a disease maintains a steady low level means that at fixed level. frequency at a moderately regular interval. For example, the common cold, or we can also say the chicken pox in US or malaria in Africa. So this is endemic. The other is hyperendemic disease. The hyperendemic disease, this is the intermediate between the endemic and epidemic. The hyperendemic, that this is the gradual increase in occurrence of frequency beyond the endemic level, but not to the epidemic level. For example, the common cold during winter months. So the frequency of the common cold, it increased during winter months. So this increase of common cold in the winter season, so this is the hyperendemic. Now the other is an epidemic. Epidemic, Greek word epidemios, upon the people. So this is a sudden increase in the occurrence of a disease above the expected level. Now in this graph we will explain it, that influenza, this is the example of a disease that often achieves epidemic status. The first case in epidemics is also called the index case. So the index case is the first case in epidemic. Now, in this graph, you can see here that at this line, it represents the number of cases per lakh individual. For example, 300 cases per lakh, 400 cases per lakh, and so on. So, and these are the times in years. So you can see that here the two lines are present, the blue one and the red one. The blue one, it represents the endemic level, while the red, it represents the epidemic level. Now you can see here that the solid blue line indicates the expected number of endemic cases. So the blue line, it represents the expected number of the endemic cases. So it represents the endemic level. Now the connected red dots indicates the actual number of cases. Now the dots here are present, it represents the actual number of cases, and the epidemic is marked by the breakers or sharp increase in the number of cases of a disease. So when the sharp increase occurred from the endemic level, so then it become epidemic. For example, this one, this is the epidemic 1 in 1996. This is the epidemic 2. This is also a sharp increase from this blue line. So this is the epidemic 2, and this one is the epidemic 3. So now you will know that what is the difference between the epidemic and endemic. So this is the epidemic, and this blue color, it represents the endemic level. Now outbreak. Outbreak, on the other hand, it is the sudden unexpected occurrence of a disease, usually focally or in a limited segment of a population. The outbreak, it is less serious as compared to the epidemic. Now another is a pandemic. Pandemic, from Greek word pan, mean all, or P also stand for passport, that when an epidemic has a passport that can cross the borders throughout the world, that can infect many people throughout the world. So this is then the pandemic. So this is an increase in disease occurrence within a large population over a very wide region, usually the world. So pandemic disease spread among continents. For example, AIDS in the 1980s, and now the very common example, you will know all that, the COVID-19 in 2020. So this is a pandemic. Now the other terminologies are the epizootiology. Epizootiology, this is the discipline that deals with the factors that influence the frequency of a disease in an animal population. That when we study about the factors that influence the frequency of a disease in animal population, so this is epizootiology. The other is enzootic. For example, enzootic, so this is the moderate prevalence of a disease in animal. As we studied the endemic, so this is the enzootic, moderate prevalence of a disease in animals. Now when the sudden outbreak of a disease occur in animal, then this is called episodic. For example, epidemio, so this is episodic. The panzootic, this is the wide dissemination of disease in animals. So this is called the panzootic. And this is all about today's lecture. Thanks all.